My name is Brouillard. I'm now 54 years of age, and today I thought I'd sit down and tell you a story that started about 3 years ago. I was at work, and it was my second patient a day. I work as a physician, and I noticed that I wasn't doing things as well as I normally can do. I was having some problems filling out a prescription, and it became obvious to me that I was having some difficulty with writing, and it became more difficult. And then I also noticed it became somewhat more difficult with my speech. And though to this day I'm not too sure that the patient I was seeing at that time actually ever realized it, but I did walk him to the front. I gave him his return to clinic appointment in a year's time, and I realized at that time I was having a stroke. And it became more apparent as I went to one of the nurses, and I said to her, I'm having a stroke. I need to go to the hospital. And initially she looked at me and she said, Dan, stop kidding around. And then she kept looking at me, and then she says, you're not kidding around. And she realized that I was having some difficulty communicating with her. My words weren't coming out the right way. And at that time, I made it very quickly to the hospital. We're only a few blocks away from the hospital where the clinic was, where my clinic here is in Kingston. And we got to the hospital, and my initial impression was, well, it's only been within a few hours. I'm going to get some thrombolytic therapy, which is really clot buster therapy, and I'm going to do very well. I know when I left the clinic, I told my colleague, I said, don't worry about it. I'll be back on Monday. That's certainly not what happened in the hospital. When I got to the emergency, I realized that there was a few other issues, and those issues were very surprising to me in a way. They first of all noticed that my blood pressure was very high, and I had been hypertensive for a number of years, but I thought I had it under control with some medications. Obviously that wasn't quite the case. I hadn't had it checked for maybe about 9 months, and blood pressure was very high. They also did some blood tests and came back to me and said, which medication do you take for your diabetes? And that was somewhat of a surprise, since and according to me, I didn't have diabetes. And so they said that because the blood pressure was so high, they had to get the blood pressure down. They were going to look at things, and initially it wasn't too bad in the emergency. I was having some problem with my speech. I was having a bit of weakness in the leg and the arm. Really, at the end of that day, I didn't end up being a candidate for clot busters, but at the end of that day, I had no movement on my right side, and speech was very difficult. And those next 2 days was very, 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 very emotional for me, in the sense that I realized that the stroke was more than a small stroke. My initial thought was I had been treating strokes previously when I worked in the hospital, and I said I knew this was a fairly severe stroke. And more importantly, they had also mentioned to me that after they had done a few scans, that I had about previous to this strokes, I had 4 strokes, and though I had never realized that, I had 4 silent strokes. So I knew my life was going to change. The first thing that happened, as I remember quite well, it was about less than 72 hours after, I had two therapists come up to me and telling me that they planned to get me up and sit in a chair. And I remember that for a while, because I was wondering, how did these 2 ladies, which very delightful, but they weighed about 120 pounds each, if that, how were they going to get me out of bed and put me in this chair? Because I know I can't help them. And the interesting thing about this, and also what I didn't mention, is I wasn't quite as light as I am now. I was about 240, 250 pounds, and I'm thinking about this, but I remember getting up in the chair, getting set up in the chair, and I remember them telling me, it's important we start you doing your physio and your rehab. And I said, we should, think about that right away, and that's why we want you to start working on it. And every day they come in and do some more work on me, even to a few days later I was in the physiotherapy room, and they were getting me up and trying to get me to walk and trying to stand. Not that I was doing it, but certainly I think that was pivotal. And what was also amazing, and you got to realize I've worked in a hospital, it seemed that everybody involved in it was sort of, every time I was in the stroke unit, and then everything seemed to be directed in terms of getting me better. And from the Kingston General Hospital, I ended up at St. Mary's, where I spent the better part of 3.5 months. And when I got at St. Mary's, I still was, for lack of a better term, bedbound. I remember that quite well, and I faced some more emotional hurdles. It was about my second night at St. Mary's. There was a cardiac arrest on the floor. And I remember my first reaction was, I got to get out of bed and do something. And I realized I can't get out of bed and do anything about it. And I was listening to the rustling sounds and the things going on. I realized that something had changed in my life, and certainly at that time, I think I realized I was going to have to really concentrate more on myself recovering from the stroke, and life had changed. St. Mary's ended up being an experience that lasted over 3.5 months, and by the time I left St. Mary's, I can say that I could actually walk with a walker, and to be honest, I actually didn't think I was going to see that day, and after almost a month and a half in a wheelchair, and really a month where the wheelchair was not propelled by me, I really felt that was quite an accomplishment. And I continued to have therapy, and the therapy really was continued as outpatient for the next almost 3/4 of a year. And during that time, I started to slowly regain some of the function. Not so much, the leg was always returning, but there was a question about work. And as I've said, I worked as a rheumatologist. As a rheumatologist, I realized that I needed both hands to do a physical exam, though I probably could have trained myself to do a physical exam with both hands, but examining of joints really is difficult with one hand, and especially to find out if a joint's swollen and things like that. A little over a year after my stroke, I became quite convinced that I would be able to return to work, and I have been able to accomplish that. I have returned to work, and the limitation has been one of an ongoing limitation of that it takes me longer to do the physical things that I used to do work-wise. But I think my occupation has allowed me to do that, because I've always said, I've noticed that it's what it's allowed me to do is, patients are very forgiving, because if you get to spend more time with them, they don't really mind it. I thought that was going to be a problem, but it isn't. I'm slow to do a physical exam, and I have changed my habits. In terms of my blood pressure control, it's been critical for me to basically go to a normal salt diet. I always say low salt, but it really is a low salt diet, and it's been hard on looking for food with low sodium, and I could easily eat a jar of pickle a day if the pickles were in front of me, and unfortunately pickles are very high in salt, and now I don't eat the pickles. Well, shouldn't say that, because we figured out a recipe to make pickles without salt, but those types of things have been very difficult, changing my habits. The funny thing about what's happened, having the knowledge but not acting on it, a few months before I had my stroke, I did a talk about modifying risk factors to avoid strokes and heart disease. And I knew exactly what I was doing wrong, but I still was doing it. And I guess I wish I could figure out a magical formula to change people's habits before they ever have a stroke. And There's no doubt that I've changed my habits, but in a way, people ask me, "Well, you really have a lot of willpower," and I'm not at work, especially when I'm avoiding things at lunchtime. And I don't think it's willpower. I really think I can't afford to have another stroke, and that's, to me, has been a powerful incentive not to do them. I just, in a way, I wish I would have had that before I ever had the stroke, and before I had blood pressure, before I had diabetes. Because managing my diabetes, managing my blood pressure, is a full-time job. Do I still do therapy? I will do therapy, I think, for the rest of my life. I'm actively involved with still doing my self-directed physiotherapy. I'm involved with doing fitness therapy, which is directed to one of the programs that is run via Queen's University for people with mobility disorders. I'm healthier now, and I know it's a funny thing to say, because when I tell that to people, they look at me and they sometimes wonder if there's something wrong with me, because I'm healthier now than I was before I had the stroke, and I feel better. This man says to me, he's changed he came and his blood pressure is perfect. And he says, "Well, you told me, get rid of the salt, lose the weight, and exercise." I said, "Geez," I said, "if it was that easy, I wish I had that kind of ability to change 10 years ago." And the first year, I honestly feel that I had about 230 people that were directly involved in my stroke care that made a difference to me. And that, to me, is an incredible amount of expertise. And it went from people helping me in the hospital, making my bed, to my family members contributing, to the community. It's it's the bus driver that helped me get on the bus when I know didn't have to help me on the bus. The first time I took the bus, when I left, when I finally was able to ambulate outside of the hospital. All of those things I think are critical in people's stroke recovery, and it's an amazing richness that when you're exposed to it. My recovery continues today. I continue to improve every month. I see slight improvement. There's sometimes they're very small to some people. To me, they're big. Just within the last few weeks, surprisingly, I've been able to start extending my little finger. This little finger here, my right hand's the one involved in this little finger. I've been able to independently move it and extending it, and I'm even able to bring it across. And that, to me,